My name is Allon Barsam. I'm a consultant ophthalmic surgeon. The Sulcoflex Trifocal IOL or intraocular lens is a supplemental intraocular lens which is designed to go in the ciliary sulcus, which is this space in front of where the natural and in the bag artificial lens goes, and behind the iris, which is the coloured part of the eye. And it's designed in order to enhance the outcome of traditional cataract surgery. So if someone has a cataract operation and the outcome in terms of their refraction, which is what their requirement for glasses would be, is not as planned or is not optimal, then it can be enhanced with use of this secondary lens. The Sulcoflex Trifocal Intraocular Lens is a combination of two tried and tested existing technologies, the Rayner Sulcoflex secondary supplemental intraocular lens with the optics of trifocal technology for spectacle independence. Trifocal lens technology is lens technology which splits light and allows patients to appreciate vision at three distances: infinity distance vision, intermediate vision such as for computer use, and then near reading such as reading the menu in a restaurant or reading documents or newspaper or a book. Any patient who has had cataract surgery in the past, providing they fulfill the criteria for suitability for trifocal technology, they are candidates for trifocal Sulcoflex lens for spectacle independence. Sulcoflex trifocal gives the option of enhancing their vision so it can correct the distance, intermediate and reading vision requirement simultaneously, making these patients completely independent of glasses for all activities. The Sulcoflex trifocal intraocular lens procedure, when done as a secondary procedure in a patient that has pre-existing intraocular lenses in situ or in place, i.e. a patient that's had cataract surgery before, is very straightforward. It can be done under topical anaesthesia, which means drops alone, and it is done in a micro-incisional or keyhole type technique. The lens is injected inside the eye, surgery is completely painless, and the lens is then positioned in front of the existing artificial lens, and this takes a matter of minutes. The recovery is also quick, as there's very little surgical time and surgical procedure required in order to implant the lens. One of the nice things about the Sulcoflex trifocal is that it does give us a reversible option. What that means is, in the unlikely event that someone is not happy with their vision, we do have the option of removing it in an atraumatic way without causing any long-term problems, because there is no manipulation required of the capsular bag, which is the most delicate, fragile part of the front segment of the eye. The advice I would give someone who's thinking about the Sulcoflex trifocal intraocular lens is, first of all, to seek out a surgeon with the appropriate experience, qualifications and expertise, namely a cataract surgeon who also has an expertise in refractive surgery and will have had experience with trifocal lens technology. So the technology, whilst it could be of benefit to many people, will not be useful for absolutely everyone. And the first step on the journey is to have the assessment done, to decide if they are suitable, and then to have a discussion about what's involved with the surgery, as well as the risks, benefits and alternatives, so that the patient can make an informed decision.